Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Bangkok Pattaya Hospital come and they do these special mornings for us, and they have wonderful speakers. Today somebody else is talking, so I'm just stopped waiting to go on. Dr. Niyom is going to give a talk today. He's going to talk about what can happen to your brain as you age. I think I've remembered that correctly. I think it's something like that anyway. And, what you might be able to do to help manage it. This is a subject dear to my heart. My mother had Alzheimer's, and we supported her in a home as long as we could, and then she went into a specialist nursing home, etc. And he's also, one of his areas of interest is epilepsy, and my brother was epileptic. So, this is an incredibly important subject, neuroscience, and more important as more important people get older and people live for longer nowadays. So very warm round of applause for Dr. Niyom. Thank you so much for coming. I've got some water for you if you need some.
Thank you so much for excellent introduction. For today, I'm welcome. I'm pleasure to talk about the issue of my specialty about the brain condition. So I will talk about issue of dementia. All right. So actually, dementia it's not only kind of memory problem. The memory problem just part of the brain function. So in dementia, they have a global deterioration of the brain function. Apart from the memory, may have mood change, may have behavioral change, disorientation, memory, not only, but okay, memory is the main symptom. But many domain of the brain function will lose. And dementia is like a syndrome. If by disease we have Alzheimer disease, we have dementia that associated with stroke. We call vascular dementia. Or dementia that have Parkinson's symptom, we call Lewy body dementia. Or some condition, low thyroid hormone, vitamin B12 deficiency, or neurosyphilis or hydrocephalus. This can present as dementia. Some people may have more than one disease. They may have a mix between vascular dementia and Alzheimer. We call mixed type dementia. But anyway, the Alzheimer disease is the most common of called dementia, accounting for 60 to 80% of all dementia. But actually, the dementia is not normal aging brain. Sometimes, if our age progress, we can forget sometime, but we can recall back, right? And but aspect of dementia, it means it progressive worsening. And right now, population who suffer from dementia around 50 million people around the world, and in the next 20 years, maybe 3 times, right? What sign of or symptom of typical, like a normal aging brain? Or I can say like a benign forgetfulness. Sometimes we can make occasional error, like managing finance or bill, or we forget names of friends sometimes, or forget appointment. Or we may misplacing things sometime, that's okay if we can recall back. If it's not pattern of progressive worsening by time, we can call this benign forgetfulness. It's not affect our function. Yeah, but in dementia, it will progressive worsening and affect our daily function. All right. So dementia is a syndrome. They have many symptoms, but if we point of view of disease, the Alzheimer disease is the majority of dementia causes. So dementia is general term. We lost memory, lost language, problem solving, and thinking ability. Yeah, and it should be severe enough to interfere our life. If not interfere our life, we can say it's aging benign forgetfulness. Yeah. So dementia is specific disease because when we do autopsy, we can detect abnormal protein in the brain cell, and that's why we said it's specific disease. Okay, by forensic study. But dementia is the general term. If people visit doctor because of progressive memory disorder, firstly, I cannot say it is Alzheimer's disease because it needs more investigation. But I can say it probably dementia because they have a syndrome, progressive memory loss plus behavioral change, mood change, something like that. So what is the risk factor of dementia? Some risk factor can be modified or prevent. Yeah. So aging is one risk factor, and second, the genetic. Okay, and disease happen to affect to the vessel, like diabetes, hypertension, high cholesterol, heart disease, sleep apnea. If people, it's like risk to be develop stroke. Yeah. If people have stroke, they may have more chance to have dementia. Because when the oxygen supply to the brain cell, the oxygen go by the artery. If your artery not good, your brain cell lack of oxygen and maybe the number of brain cell reduced by years faster than normal people. And infection like HIV, neurosyphilis, this kind of bacteria or virus infect to the brain also. And lifestyle like smoking, lack of exercise, depression, alcohol use, poor diet style, or history of head injury, concussion brain. Yeah, it happened. Yeah, many times. It can have a long-term effect to the brain also. Yeah. So this is the early sign and symptom of Alzheimer's disease. First one, memory loss is the main symptoms. And second, difficult to plan or solve the problem. Difficulty completing familiar task. Yeah. Confusion of time, place, direction, and trouble understanding visual image, yeah. And have new problem with words, speaking or writing, forget things, misplacing, and cannot recall, cannot recall. Poor judgment, because our judgment need a brain part we call frontal lobe. Yeah. When we get Alzheimer's disease, the first part of the brain that will get affect will smaller is the frontal lobe and temporal lobe. Yeah. That's why some symptoms present more than other symptoms. Yeah. Yeah, and loss of function, withdrawal from work, social activity. Yeah. And This symptom we can put in the paper test. We call mini mental state examination. It's like screening test. If our age more than 65, we sometimes we have to do the test, the paper test. They have score, the full score, 30 score. Yeah. If less than 22, it dement. Yeah. And if we start to lose memory, we advise patient to modify their risk factor. Sometimes we can delay or slow down staging of dementia. Yeah. But we would like to do early detection. Yeah. Should do paper test, MMSE. Yeah. Maybe do every 2 years, something like that. Yeah. Start age of 65. So the diagnosis, firstly we start with the history taking and exam patient. Some patient they may show up a sign of trembling hand, like a Parkinson symptom. This and plus with memory problem. This may not Alzheimer, but it kind of dementia. We call Lewy body dementia, or even the hydrocephalus. If have water retention in the brain, may present with shorter step, or I say in medical term magnetic gait. It's like when we walk, difficult to lift up our feet from the floor, and the step will shorter. Yeah, and have another symptoms, cannot hold urine. And the last one, memory loss. So in hydrocephalus have 3 main symptoms. If we early diagnose and we drain the fluid out, the dementia can treatable. Yeah, we call treatable dementia. Yeah. And lab test we will check about thyroid hormone, HIV, syphilis, B12. If we detect the abnormality from blood test, like a B12 deficiency, we can replace B12 and memory will come back. Yeah. Or even some people they addict to alcohol. They may develop memory problem later because of the vitamin B1 very low in alcoholic. We can replace B1 and then their memory will improve. Yeah. Yep. And we do MMSE, including the MRI scan also. Some people they may have fell down and get the slow bleeding under the membrane, the meninges. They may have we call subdural hematoma, not present with headache because the blood oozing very very slow. They not present with headache, but they may present with dementia. If we detect chronic subdural hematoma, we will drain out and patient improve. Yeah, it is a treatable dementia. Yeah. Sometimes we have to do spinal fluid analysis if we suspect infection. Neurosyphilis, syphilis, this kind of syphilis can stay in the body more than 20 or 30 years. Yeah. We have to take out the spinal fluid for the lab. If it shows positive, we have to give antibiotic. Yeah. Even kind of epilepsy, if uncontrolled epilepsy may deteriorate cognitive function. And we can do EEG to check the brainwave also. And we can adjust medication for epilepsy control. And this can improve the brain function also. Dementia have many stages. Some, it like we say pre-dementia condition. In medical term, we call mild cognitive impairment. MCI. Yeah, MCI may turn to dementia around 40%. Yeah, if we do MMSE or paper test and we detect MCI, it's good time to advise to the patient to modify the risk factor to avoid turning to dementia. And if dementia develop the early stage, patient may take care. Patient will take care their daily activity. They can stay at home, can do everything, take shower, eating by themselves. But if it turn to middle stage, they need partial support. Yeah, and if the late stage may need 24-hour caregiver. Yeah. It takes time for the first stage to the last stage around 12 years. Yeah. Yeah. And most type of dementia cannot be cured. Yeah. But we can delay, slow down. Yeah. And treatable dementia is found around 15%. For hydrocephalus, for vitamin B12 deficiency, B1 deficiency, subdural hematoma, hypothyroid, yeah, something like that. And 85% it is degenerative brain disease that cannot be cured, but can do a delay or supportive treatment. And in aspect of medication, we have medication to maintain the brain neurotransmitter, yeah, like donepezil, Exelon, or memantine, or like extract from ginkgo biloba. Yeah. In aspect of behavioral problem, we can use like a neuropsychiatric medication. Yeah, and therapy, yeah, with physical therapy or occupational therapy can improve like a gait balance, yeah, training, or exercise, cognitive therapy, yeah, many kind to improve or slow down brain deterioration. Or even music, or light therapy. We have light therapy in late stage dementia. Sometimes patient get delirium. They confuse in the night time and daytime they sleep, something like that. You know, that have a fluctuating brain symptoms. Sometimes we have to check for the environment, what kind of light fit for them. And finally, in the middle stage dementia, they need more support, like a caregiver or friend, you know. It's not only medicine. Yeah. And in 2 months ago, from Lancet Journal, they have recommendation. They can find 14 risk factor that associate with dementia, and they have percent impact also. This is a very update. Yeah, if we can modify like this, if we can do all of category, we can prevent dementia for 45%. Yeah, yeah. If 7% impact is hearing loss, if we have hearing problem and we do something, you have hearing aid, this can slow down your brain because your brain gets sensory or gets signal from your ear. If your ear bad, your brain cannot get signal and your brain lazy, right? Yeah, and LDL control. Normally, if you have no heart disease, if you have no artery narrowing, in normal people, we keep LDL around 130, 130. But if you get diabetes, you put stent already, you have to keep more tight control, less than 100 or less than 70, for LDL. This is a 7% impact, okay? And 5% impact factor, lifelong education. Actually, we can start when we was young, if we interest to do education, you know. In some country, people cannot get through educational. They may have more incidents of dementia when their age progress. Yeah. Educational, important, okay, 5% impact. And social interaction. Same, you gather in this room, you have social contact. Yeah, social interaction have impact 5%, okay? And depression, air pollution, 3% impact. Yeah. Depression is treatable. It because of the brain have low serotonin. We have medicine to give to patient to improve the serotonin level, and we have to encourage them to do positive behavior that help for dementia. And visual loss, I mean, it's like a cataract. If we have cataract, we get information to our eyes by eye and report to the brain. If you have bad eye, you not correct your cataract, you will lose brain function faster. Okay. Physical activity, like they say, we should walk at least 30 minutes every day. But if somebody cannot do every day, they can do like a 150 per minute per week. Keep yourself active, brain active, body active. And control for diabetes. And no smoking. They said no smoking, but they allow for a little bit alcohol, by study, okay? But no smoking. Hypertension and overweight. These have 2% impact of each, okay? Alcohol, they allow just, they calculate by gram. They said around not more than 12 units per week. I look it around 1 unit, around 8 grams. Yeah. That means if compared with wine, it's just 1 glass of wine every day. Yeah. It's not over. Yeah. They allow 1 glass of wine every day. Yeah. And smoking, have to stop for this one. All the percentage will sum up to 45%. But if more than 45%, we don't know yet what is the impact factor. They need more study and maybe genetic that we get from inborn, something like that. In 3 years ago, I read the article, and last time they can find not much impact factor like this. They find only because the Lancet say in 2 months ago they have new impact factor. It is visual and air pollution. Before they have 12 impact factor, but just update in 2 months ago. Yeah. So the lifestyle mean diet and exercise and social. Yeah. And have good habit, you know. Yeah. Yeah, that's the dementia aspect. Yeah. 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 45% can be modified, can be slowed down.
All right, hands up everybody who's now going to give up alcohol entirely. Oh. All right, questions and answers time. Somebody has questions. I have a comment or two. My mother had Alzheimer's, and who's had somebody close to them with Alzheimer's, right? The best description I ever heard of was the funeral that never stops. Because every day they're dying a little bit in front of you. More of them's dying every day, right? The funeral that never stops. Also, you know, this isn't just about us. This is about the people we know. I met this guy, and the first time I met him, it was in Pattaya. I thought he had that sort of glazed look that they sometimes get, the dementia people. And I thought, this guy's got dementia, right? He's got Alzheimer's. And it became more and more obvious. And do you think I could convince the other people who had known him for years that he had Alzheimer's? No, it's like, no, he's pretending. He's putting it on. It's like, seriously? Right? And when his son finally came over, he flew him. I took him to Bangkok Pattaya Hospital once, and they said, and they gave him some pills to help slow it down, some prescription. But of course, he'd forget to take them, of course. So you need somebody. Yeah, you need a caregiver to say, help, here's the tablets. And then when his son came, he flew him back to England like twice, I think, for a diagnosis or something, as if you can actually diagnose Alzheimer's, really. But and that actually imprinted him, and that he could leave to England at the drop of the hat. So suddenly they got a phone. Somebody was holding his passport, and he asked for the passport back. So they gave it back to him. Next thing we hear, he's at the airport going to England off his own bat to get back together with his ex-wife and stuff, because he put that in. Because sometimes, you know, Alzheimer's, they lock on to something and they don't let it go. And they can even forget why they originally thought of doing this, right? But they'll still keep doing it. So, yeah, but eventually, of course, he had to go into full-time care with the Alzheimer's, and he had a good nursing home here that looked after him. But, yeah, just be wary of, it's not just about the people who are in the room, but the people you know. So we had a question over here.
There's been some scandals in the press recently about prominent researchers having falsified data in Alzheimer's studies. Is that beginning to affect future research or the direction of what's been going on causes of Alzheimer's?
Now they have studied, they use technology like we use for cancer. We call targeted therapy, because we will target the protein in the brain, the brain cell, we call amyloid plaque. And they do in animal, they can dissolve the protein out in the animal that have this amyloid plaque in the brain. Yeah, but by symptom improve, even they melt that protein out, the mice not improve cognitive function. So now they plan for more earlier to use this medicine. So if we have somebody in our family have like Alzheimer's disease, and we check ourselves, maybe by PET scan, and we start to have amyloid plaque, but we have no symptom yet, we should start but now just in experiment, they will start earlier, not let the brain have this kind of abnormal protein, and they hope we can preserve the brain cell. If we start maybe at like 40 years old, you know, not 60, not 70, yeah.
So, sorry,
early detection. Yeah.
What was the medication called again?
Targeted therapy. If we see somebody they have like cancer now, in oncology they have new medicine and can prolong life. We use not same chemotherapy, you know. If chemotherapy, they bomb tumor, they bomb normal tissue. But if we use targeted therapy, it will target to the target organ or target tissue only. Yeah, yeah. Now we use in a lot in oncology. Yeah, yeah.
Thank you for your presentation today. We had talked you presented about things not to do, such as alcohol and smoking. But what about lifestyle and diet? What can you do to help reduce the impact of dementia?
Okay, no smoking, but alcohol allow 1 glass. Okay, 1 glass every day. Lifestyle. Firstly, we have to calculate our body mass index. It shouldn't more than 75. Okay, body mass index, not high. Because if you have high body mass index, you may develop sleep apnea, hypertension, insulin resistance. Yeah, I think the body weight is the keystone. They make several problems come as a consequence, you know. Yeah, and diet style, not over carbohydrate. You should prefer fiber and protein. Some people have to avoid protein if we have chronic kidney disease and the GFR function below 50. We have to control protein, you know. But if your kidney good, you should take enough protein, yeah, and reduce carbohydrate, because carbohydrate will turn to be sugar in your bloodstream, yeah. So I teach my patient low sugar, low carbohydrate, but high fiber, high protein. Yeah, it's a healthy style. Seem like a Mediterranean style, something like that. Okay. And exercise, keep our brain active, our body active. Walk at least, 50 minutes daily. Yeah, yeah.
Thank you very much for a great talk, Dr. Niyom. I was listening to some specialists, Harvard specialists and some other big name university specialists on the topic that you're addressing today. And a couple of them referred to Alzheimer's as type 3 diabetes. Have you heard this expression, and do you have anything to comment about it? I noted that 2% of the reductive activity you can engage in is taking care of diabetes, but what percentage of people with Alzheimer's have fully blown diabetes? Do you know?
Percent of
what percentage of people with Alzheimer's have diabetes type 1 or 2?
I don't know exactly, but yeah, that's I present to you. If your vessel, your vascular narrow, by many factors, by diabetes, by high cholesterol, by smoking, your brain cell lack of oxygen, and if your brain cell would like to excrete the waste product from the cell, they have to excrete by vessel also. That very strong correlation between group of vascular disease and the brain degenerative disease. Yeah, not only Alzheimer. Parkinson also. Yeah.
Are strokes related to Alzheimer's or dementia at all? If you've had a stroke, are you more likely to suffer from Alzheimer's or dementia?
Right. We call mixed type of dementia. Or some people, if they have stroke area hit to the frontal lobe and temporal lobe, it may start acute dementia suddenly. Yeah. Because it hit to the memory area of the brain. Yeah, we call, if it's from occlusion, we call strategic infarct. Yeah, present with acute dementia. Yeah. Damage the temporal lobe. Yeah.
Thank you. I was just interested in the relationship between Alzheimer and Parkinson's disease.
Right. Both is a neurodegenerative disease, and both can be, can mix up also. Yeah. But if by pathology study, by autopsy study, the difference is in Alzheimer, they detect kind of protein we call amyloid plaque in the brain cell. But in Parkinson, different protein, different color, because they have to dye. When the pathologist they study, they have to put dye to the tissue, different color. This kind of protein in Parkinson is like a Lewy body. Yeah, Lewy body. And in Parkinson, the abnormal protein, they stay in specific area, not the same distribution with Alzheimer. In Alzheimer, they may stay in frontal lobe, temporal lobe. That's why people with Alzheimer present with dysfunction of frontal lobe and temporal lobe, like forget first and then behavioral change later. But in Parkinson, the distribution of the abnormal protein attack to brain stem and deep brain part we call like a basal ganglia. This is the this area control motor function, and then they will start with gait, walking problem, or rigidity of hand or trembling of hand before they lose memory in the future. Yeah.
Thank you for coming today, Doctor. Just you said in your talk, one of the factors that delays dementia or does away with it is lifelong education. What did you actually mean by that?
If you're interested to do some hobbies, it is education. If you like to play chess, play card, bridge,
So, for example, I spent my working life, which I only finished a year ago, as programming computers and learning new languages and new systems and that sort of thing.
Yeah, right.
That's what you're doing. Okay, thank you.
It's not in system education, but anything that you're happy to do, you enjoy to do. Yeah.
I think that was a really, really thorough talk. Thank you so much. And huge round of applause. And just a couple of practical takeaways. If you see a friend and stuff and you think maybe their memory's starting to go, etc., or you notice symptoms in yourself, address it early, right? Go and address it early, and then you can get some medication to slow it down and address things that will help slow it down. And make sure that somebody's monitoring that you're taking the pills every day, etc., which is what didn't happen with my friend. Now, we have an apology because always we have a certificate for speakers, but of course our certificate carrier has broken his arm, so I don't think he can carry them at the moment. So we don't have a certificate, but we will get you one within the next 10 days because it's a big deal for the doctors to give these talks. They put the certificates up on their walls and they're very thorough in making sure they give us the best possible information they can, as you saw again today. So thank you so much, Dr. Niyom. It was really one. All right, so I think we've got the lucky draw. So if it's, this is a chance for you to be generous, because if you win it's for a brain, scan, etc. type thing. So if you win it and you think your brain's perfect, you can give it to somebody else. So I don't think your brain's quite normal. You better have this instead of me, okay? All right. Next slide, please. Oh, it's happening from up the back, maybe. Next slide. No, not open forum. Next slide from the previous thing. No, not yet. Not open forum. We got the Lucky Dwarf prize. And next slide. Okay. There you go. Lucky Draw prize. Bright brain screening. Who here has a bright brain? Only 2 or 3 people. Okay. All right. So I think the doctor's going to do the draw. So come on out, Kunjis. Round of applause for Kunjis, who organises the speakers and relates to us. All right, 3 lucky people are going to discover if they have a brain. Yeah, I think so. Number 9. Number 9. Check your numbers. Come on. You know, you all got these if you went through the thing. Brian Maxey. Where are you, Brian? He's probably outside on the desk. There you go. No, we believe you. Number 9. There you go. You get a lucky door prize. It's pretty small for a door, but anyway. Yay! Number 3. Come on, 3. Oh, 3, 5, 35. Hey, there you go. Come on down.
Another Brian. Brian.
Notice the relationship between Brian and brain. Okay, Brian. Yeah. A Brian in need of a brain. Okay, come on, get your lucky dog. Yeah.
Yes.
Yeah.
With it.
Mr.
All right.
Brian.
Yeah, stay here. We'll take a photo of everybody together in a second. One more lucky door prize. One more. 11, 1. Oh, there you go. Come on down, Mr. 11. I didn't win anything, so I'll get out of the way. Yeah, take a look with the lucky door prize winners. People after this, nobody will ever be able to tell you you're brainless again. And while I think of it, just a round of applause for the staff and everybody and all the great job they do here. All right, you may go. Your work here is done. Thanks again, Dr. Niyom. All right, now we're moving on to the open forums part of